Veterans are among the Americans most at risk for suicide and other serious mental health conditions.
For years, resources have been scarce, but change is coming. In-depth reporter Alicia Nespresso finds out what change could mean locally.
Jessica Behne is a Marine veteran.
I loved the Marine Corps. It was my passion.
She says she loved her 12 years in service and all the connections she made during that time.
I loved the camaraderie, the family environment, the relationships she built.
But when she got out, she noticed something was missing.
When I got out, the transition was quite challenging. I had a lot of family and friend support, but I couldn't find a therapist that had any type of background that I could relate to or they could relate to me.
Behne said it was important for her to have another veteran to talk to, but was having trouble finding one.
I found that to be really challenging. There was a lot of questions asked about acronyms and language I use.
She found a gap in the transition to civilian life and decided to fill it. Behne now is a licensed therapist who owns Breakthrough Therapy Texas.
Being able to go to a therapist that kind of knows where I'm coming from was really important. And so I like to be able to offer that to veterans just because of the unique circumstances that we go through in the military. And then when we come out, it's just hard to relate if you've never done it.
She says many of the patients she meets with are dealing with complex trauma. According to the National Alliance on Mental Illness, depression and PTSD are also among the most common mental health concerns for veterans. They estimate about 15% of Iraq and Afghanistan veterans have been diagnosed with PTSD. They're also at a higher risk for addiction, as roughly 20% are believed to turn to drugs and alcohol within the first 3 months of returning home.
Just like the military, we have to work as a team, and part of that is knowing where your resources are.
The Department of Veteran Affairs is hoping to make those resources more available for people struggling with their mental health.
Really, it's more about just more education and more access for veterans, specifically when it comes to suicide prevention and also dealing with veterans in crisis.
Starting this month, veterans will have access to free emergency mental health care at any VA hospital or clinic.
A lot of times community hospitals, there were different questions, different things along those lines, but now it's really just opening up the field to at least get them in, assess, and be able to move forward, or at least get them on the right track.
The department estimates of the roughly 18 million veterans living in America, only half are enrolled in their benefits. This new policy will cover all veterans, even those who are not enrolled.
We're offering education, resources, and tools for veterans to take back control, whether it's depression, anxiety, PTSD, that has taken control of their lives, just really giving them the tools and the resources to be able to move forward.
Moving forward can be difficult when you're struggling with your mental health. There are resources to help, both at the VA and with veteran therapists like Behne.
No veteran is too far gone. No veteran is broken by any means. We are warriors. We are trained as warriors. We will remain warriors, but we're injured. And sometimes those injuries just need to be treated.
In Temple, Alicia Nespresso, 25 News.
And if you're a veteran suffering with your mental health, you can text or call the new suicide prevention hotline. That's 988 and then press 1.